Welcome to the UCL Centre for Anaesthesia Single Best Answer series. Don't worry if you don't know the answer straight away. They're meant to stimulate your learning and develop your critical thinking. If you want, you can discuss the answers with your tutor or an anaesthetist in theatre. Press pause now while you read the answers. So this question is again about fluid. Don't forget the NICE guidelines have 4 parts to them. They have assessment, resuscitation, routine maintenance, and replacement and redistribution. Those are the 4 elements. We're asked here about a fluid challenge. That's the resuscitation phase. Of course, it's going to follow an assessment, and hopefully by now you'll have thought about ways to examine the cardiovascular system. Don't forget history, examination, investigation. Ways to examine the cardiovascular system to determine in some ways how much fluid's needed, but also these are endpoints of resuscitation. You're looking for those things to come back to normal. You're looking for, in this case, the heart rate to come back to normal, the peripheries to warm up, and the oliguria, that's low urine output, to improve, to increase. So as well as signs of hypovolemia, these are targets for resuscitation, as we call them. So the question asks about a fluid challenge. Well, the NICE guidelines are very clear. NICE guidelines say 500 mils of something that has a sodium concentration between 130 to 154 millimoles. Now, that's only saline or Hartmann's. In our institution, historically we've chosen Hartmann's for a variety of reasons that we won't go into here. So the answer is obvious. So A, 1 mil per kilogram of Hartmann's. That would only be about 70 to 80 mils of Hartmann's solution. No. B, 500 mils of 5% glucose. No. There's no sodium in answer B. C, 250 mils of Hartmann's solution over 15 minutes. Well, that's not correct because, as I said, the fluid bolus is 500 mils. And we've not been told anything about this person's medical history apart from that they were well. They're 35 years old and they're 72 kilograms, so they're unlikely to have heart failure. But that's something to think about. Number D, 500 mils of 5% glucose. No, that's not got any sodium in. Of course, the answer is E. Now, don't forget, you shouldn't just blindly give fluid. You have to think about what's the cause of this. Why has this patient required fluid? I'd say it's very common for patients immediately after surgery to need a fluid bolus. That's not something shouldn't be unexpected. But if they were to require ongoing amounts of fluid, you should then escalate this issue to your seniors. Think, have they got any ongoing blood loss? What's going on here? Have they got an evolving septic picture, perhaps? And as you get on in your clinical career, you'll realise that you can make judgment calls about this, about the likelihood of these things happening. If you found that the endpoints of resuscitation, heart rate, cool hands and feet, and oliguria weren't becoming normal, you should back this up to your senior. And in fact, NICE says if you've given more than 2 litres, that's 4 fluid boluses, you should seek expert help. So in summary, NICE says resuscitate with something with a sodium concentration of 130 to 154 millimoles per litre. That'll be saline or Hartmann's. 500 mils over 15 minutes. Assess the response, and if you have to give more than 4 fluid boluses, seek expert help.